Chronic fatigue syndrome, commonly known as CFS, is a controversial and lifelong disorder characterized by prolonged symptoms of intense fatigue that can reduce a person's ability to perform daily functions by over 50%. Patients with chronic fatigue syndrome suffer from a variety of other symptoms, such as anxiety, depression, headache, muscle pain, and cognitive dysfunction. All of these are linked to low mitochondrial function. As mitochondrial supports assists with chronic fatigue, it can also similarly be linked to increasing things like endurance, such as in overtrained athletes like marathon runners and long-distance swimmers. Therefore, supplementation and using health techniques to boost mitochondrial function may have profound benefits in all areas of your life. Some of the readily available therapies that can help you boost your mitochondrial function are intermittent fasting, exercise, cold exposure, the ketogenic diet, resveratrol, PQQ, alpha lipoic acid, guatacola, jiaogulan, N-acetyl cysteine, and creatine. One way to boost mitochondrial function is through intermittent fasting. This involves allowing, for example, an 8-hour window each day where you can eat food and a 16-hour window where you can only have water. During this 16-hour window, your body starts autophagy, which removes old, dead, damaged cells. This can help rebuild more properly functioning mitochondria. In one study, 8 healthy elderly volunteers found just 2 weeks of high-intensity interval training significantly increased mitochondrial function in the muscle. Cold temperatures have a profound effect on the mitochondrial number in animals. Exposing rats to swimming in cold temperatures increased mitochondrial generation by increasing the protein responsible for initiating mitochondrial synthesis. In studies performed on Wim Hof, the Iceman, it was shown he had greater mitochondrial activity in his brown fat. This was achieved by his breathing techniques as well as his cold exposure over the years. The ketogenic diet, which is high protein, low carbohydrate, was shown to slow down mitochondrial myopathy, which is a muscle disease, in mice by increasing the number of new mitochondria generated. Resveratrol, which is found in small amounts in organic wine, is created by the grapes as a defense mechanism to fight off mold. It's been studied for life extension purposes, improving circulation, and many other health benefits. In a rat model of Parkinson's disease, resveratrol was shown to prevent neurotoxicity by increasing mitochondrial synthesis and improving mitochondrial function. PQQ is one of the few new supplements that's been shown to generate new mitochondria. In mice that were supplemented with PQQ for 8 weeks, mitochondrial function and number were increased significantly. Alpha lipoic acid, normally used for blood sugar control, or used for life extension purposes when combined with L-carnitine, was shown to reduce age-related mitochondrial dysfunction, and it's considered a mitochondrial nutrient. In mice, alpha-lipoic acid prevented mitochondrial dysfunction caused by hypothermia. Guatacola, known as a pseudo-adaptogen, it's used to increase blood circulation and cognition, and it's been shown in old and young rats who were given it for 2 weeks that it increased the number of mitochondria in their brain cells and the mitochondrial function. This was linked to its role in improving cognitive function also. Jiaogulan, known as the herb of immortality, is a popular adaptogen which can balance the body in many different ways. In obese mice with mitochondrial dysfunction, jiaogulan supplementation for 2 months improved energy metabolism by increasing mitochondrial proteins AMPK. Multiple cell studies have also found that gynostemma, which is jiaogulan, exhibits an antioxidant effect on cells with mitochondrial dysfunction by modifying specific proteins that play a role in mitochondrial activity. N-acetyl cysteine is a supplement that has many uses. In hospitals, it's given if someone has had a paracetamol overdose to protect their liver. It can be used commonly as a hangover cure, as well as a detoxifier and an antioxidant. In a mouse model of Huntington's disease, N-acetyl cysteine treatment for 9 weeks reduced oxidative damage to the mitochondria and delayed the onset of motor dysfunction. Similar effects were also seen in rats with Huntington's disease. Creatine is often associated with bodybuilding and muscle gains, and there are lots of myths surrounding it. However, new research shows how it has many other functions in the body, such as enhancing cognition as a nootropic and a study aid. Creatine is a naturally occurring substance that plays a role in the recycling of ATP in the muscle and brain cells. Multiple studies have indicated that creatine is effective in restoring mitochondrial function, protecting against structural damage and oxidative stress, and reducing the impact of mitochondrial DNA mutations. Berberine, as found in plants like golden seal, has been studied for its life extension properties, in that it functions similarly to metformin, also known as glucophage, by reducing insulin resistance and protecting against the damaging effects of high sugar diet, but it has less side effects than those pharmaceutical drugs. In fish that were fed high-fat diets, berberine supplementation was given for 8 weeks, and this improved liver mitochondrial function and prevented cell death. In skeletal muscle cells, berberine prevented mitochondrial dysfunctioning by increasing SRT1 levels and subsequently the generation of new mitochondria.